Good morning, members. We'd like to welcome you all to this fifth webinar that we are conducting as the Federation of Kenya Employers. It's a pleasure to see so many of you logged in and ready to discuss this important topic. I'm Jacqueline Mugo, the Executive Director of the Federation of Kenya Employers. Today I have a very interesting panel with me. I have a guest speaker whom I'll be introducing later, and also to interact with you is our head of employment and labor relations. We picked this topic specifically in recognition of the fact that tomorrow Kenya will be celebrating the World Safety and Health Day, which globally is celebrated on the 1st of May, but you know here that coincides with Labor Day. So we want to look at the issue of safety and health and share with you what we have been doing as FKE since the pandemic was pronounced in Kenya. And we have specifically picked the title, Enhancing Workplace Safety and Health During COVID-19, a Shared Responsibility. It is our view that health and safety at work is a shared responsibility between the employer, the employee, the government, and indeed the public, especially now in this time of COVID-19. It is everybody's responsibility to ensure their health and their safety. We have been sharing with you every week what we've been doing, and today I just want to outline my opening remarks in 4 different thematic areas. One is giving you a summation of the interventions that we've taken as a federation on your behalf as members, and also share with you the international instruments that the International Labour Organization has that specifically address response to COVID-19 by its stakeholders, a global perspective on the same, and finally, as we look at COVID-19, there are a whole host of new issues that are emerging, specifically the area of health and safety, but indeed they go beyond health and safety, but today we'll be focusing on the health and safety issues. We have, as your federation, been your voice, and we've been influencing discussions in the country and policy decisions, and also interventions that the government has taken and continues to take to help us all cope with the pandemic. We continue to serve as members of the Rapid Response Team under the Ministry of Labor. We have been collecting and collating your views as employers to input into these policy conversations and interventions that industry needs. And as we speak, we're in the process of completing the preparation of our memorandum on a bill that seeks to help the country address the Pandemic Response and Management Bill 2020, which was largely moved by Senate. But we realized last week that Parliament had also picked some of the proposals that impact business, and we need, as employers, to have our voice heard. There's a bit of an echo. I don't know what's causing it. Members, sorry about that. We're trying to fix it. There's quite a lot of echo. Sorry about that, but I hope you can hear me. And so, as we engage with you, we'll be very keen to hear your responses in matters health and safety, and also your experience in following the guidelines and protocols that we issued with you, which were pretty much based on what the Directorate of Health and Safety have issued, and those issued by the Ministry of Health. And we are keen to know how you're faring and if you have any views on them. As we speak, we are also conducting a survey, which I'll speak to you at the end, to collect your views on further interventions that can be made. And this webinar that we are conducting today is one of the weekly ones that we've been doing, and this is the 5th one. So we hope that you are in agreement that this is a timely topic and that you'll all be engaged and share your views. If we look globally, there are a whole host of international standards on occupational health and safety, which the ILO has passed over many years, and we have incorporated them into the guidelines that we have issued to you. But as the ILO has clearly indicated, COVID-19 is both a public crisis, it's an employment crisis, it's an economic crisis, and so interventions to address it, and particularly health and safety, needs to involve all stakeholders, given the size of disruptions that are threatening livelihoods and the well-being of millions of people across the world. So as we speak, the ILO and its constituents, that is governments, employers, and workers, recognize and are playing a very crucial role in combating the outbreak of the virus, even as the nature of work as we know it and where it's done continues to have great ramifications on employers and the extent of their responsibilities at this time. The World Day for Safety and Health theme that the ILO has adopted is Stop the Pandemic, Safety and Health at Work Can Save Lives. It is recognized globally that the pandemic will cause a slump in productivity and leading to reduced profits and also increased costs in conducting business, given that employers are expected to keep people in employment to continue playing their role at a time when there's very little that's happening in terms of output from the enterprises. And as we see it, new ways of working are emerging and will continue to emerge. And we think the disruptions that were projected even before COVID-19 will be escalated and scaled up. So we all need to be prepared and to work together as employers to help address these challenges. Today, as we speak to you on this theme, we are partnering with the Directorate of Safety and Health Services, who are social partners. The Federation actually serves on the board of DOSH, as we call it. And we are very happy and proud this morning to have with us Dr. Andrew Muruka, who's the Deputy Director in this Directorate of Safety and Health Services under the Ministry of Labor and Social Protection. And we have discussed with him and shared with him some of the questions and issues that you've been sending to us as employers since COVID-19 pandemic was announced. He is heading the National Institute for Occupational Safety and Health, and which is dedicated to research and training in all aspects of OSH. He's previously worked as the Health and Safety Manager at KEMRI and also at the Center for Geographic Medicine Research in Kilifi. He has a PhD in safety leadership and is currently a final year candidate in biorisk management at Kisii University. So his heart and his commitment is in this area of safety and health. And we are very privileged to have him with us and grateful that he was willing to take time to come and discuss with us this morning. Dr. Muruka, as I introduce you, I want to share with you and indeed our members that some of the issues that are emerging in health and safety, especially now in the time of COVID, is the extent of the employer's liability. In the unfortunate event that an employee who is working from home or at home gets injured, or an employee gets infected with the coronavirus, what is the employer's liability? And that we will also answer as FKE from our perspective. So I'm just sharing with you some of the questions that we see are emerging. And should an employee be put under quarantine? What is the employer's responsibility? Who bears the costs? Is the employer under obligation to report cases where they think employees are infected? And the other question is COVID-19 an occupational disease? We've been answering this, and we think it is not, but it's a question that we should discuss this morning. And so this opens for us the conversations. And I now want to invite you, Dr. Muluka, to share with us your views from a government perspective. What are the expectations in terms of employers' responsibility, but really broadly, what is your directorate doing to help the country cope with this huge challenge that we are facing? What are you seeing in terms of patterns nationally? Are Kenyans really adhering to the directives that have been given to help us cope? And as employers, we'll also be sharing from our perspective what the experience has been and how we perceive issues and matters, safety and health going forward. So I want to invite you to share with us in a short presentation, maybe about 10, 15 minutes, on your perspective. Karibu sana, Daktari.
Thank you very much, ladies and gentlemen. Thank you so much, Executive Director. I am delighted to be here. I also feel honored. I will be sharing today with your members on this issue of the government's occupational safety and health guidelines on occupational safety and health initiatives. And specifically, there are three areas which I'm going to look at. The first area is what is really COVID-19. And I will be sharing the reason why I want to talk about COVID-19 at the beginning. Secondly, I'll be sharing some insight into the government initiatives to stop the pandemic. And I will be sharing also some ideas on what workplaces can do to stop the pandemic. Coronavirus is a new virus. It was first identified on 31st December 2019. Its identification was confirmed by the WHO on 7th January 2020. And at the end of January, on 30th January, COVID-19 was declared a public health emergency of international concern. And by 11th March 2020, COVID-19 was declared a pandemic. That means that it affects all parts of the world and all sectors of the economy. On 13th March 2020, Kenya reported its first COVID-19 patient. Now, this disease is caused by as what we call SARS-CoV-2. SARS-CoV-2 is severe acute respiratory syndrome. 2, because it was a daughter of the original SARS that used to spread in the Middle East and the one that spread in some parts of Asia in 2002. This family includes a common cold. And for SARS-CoV-2, or the one that the virus that causes COVID-19, it is highly infectious and it is non-discriminatory. I say non-discriminatory because we can see the people who have been affected by COVID-19, including the Prime Minister of the United Kingdom, Charles, Prince of Wales, and so many other people who are considered critical in the running of government, in the running of institutions, doctors, nurses, actually children, old people, women, men, and nearly everyone. So that's why I say it is non-discriminatory. It will affect everyone at any given time. In the US, of course, it came late, but the US is now currently the epicenter of COVID-19 outbreak. 14th of April, 27 nurses or health workers were killed or reported dead by the US CDC in the UK, in the US. And one of these neurologists, Gary Scala, 66, also died on 12th of April as a result of COVID-19. Now in Kenya, this slide is about 2 days old. We had about 343 cases and 14 deaths. I think 95 people have recovered. I think up to yesterday, the number had increased to 106, meaning that the recovery is going up as expected by this pandemic. Now, the Kenya government has put in place several initiatives, and this is what I'll be turning into right now. First of all, I want to ask ourselves why occupational safety and health is critical in stopping the pandemic. And number one is that it is only through occupational safety and health that we are able to identify workers or employees or occupations and sectors where there is high risk of contagion. And secondly, workplace-based implementation and prevention measures are supervised by the Directorate of Occupational Safety and Health Services. And thirdly, there is dissemination of information, which has high impact at the workplace level. So why is COVID-19 so critical, or why is it so important for occupational safety and health at work? Number one, it has led to increased unemployment and underemployment. And we know in occupational safety and health, the consequences of under or unemployment, they lead to increased stress in society. Then secondly, there is worsening of occupational safety and health and working conditions generally due to COVID-19. And of course, COVID-19 has led to reduced access to social protection and other effects that are affecting the labor market generally. People have lost their jobs. Several industries and subsectors of economic development have been shut down to help in the stoppage of this pandemic. One thing that makes me think that this is occupational safety and health is very important at work is that statement I got from one of the television stations, which said in Kiswahili, and I quote, "Tafadhali nikufe na corona badala ya kulala njaa." So this also means that occupational safety and health message or information in terms of awareness has not penetrated the society as it should. So the other thing that we see is that for us to succeed in the fight against the COVID-19 or the SARS-CoV-2 is that we must have access, and this one has been proved that we must have access to correct, timely information. We must conduct social distancing, water and sanitation and hygiene, and simple educational and effective communication materials need to be available to stop this pandemic. Of course, if you look at this picture on the left top corner, we see that this is what I was talking about in the previous slide in terms of people thinking that it is afadhali nikufe na corona. So if you see such kind of pictures, it really shows that there is something seriously lacking in terms of what that particular thing can do to prevent or to stop the pandemic. The second thing is that suitable personal protective equipment must be appropriate, and they must be available on a timely basis. I think I should be discussing again the issue of suitability and availability. as we know that one of the greatest challenges right now towards COVID-19 is non-availability of the global shortage of critical personal protective equipment has been highlighted by several institutions, including the WHO itself. The other challenges with this fight is the culture. I think the culture of dishonesty, the culture of um, disregard to law and order, the culture of disregarding authorities. And that's why you find that in some countries, we have had people striking and demanding to go back to work in the midst of a pandemic. The other challenge, of course, is poverty. And if you look at the picture on the lower left side, this person with what we call, I don't know what you call it in other languages, but this person who is on the left trying to have something like a mask, which is actually a calabash. It shows that there is either deep ignorance, deep-seated ignorance, poverty, or when you lose your jobs, you don't have resources to buy some of these things. So these are serious challenges or roadblocks to effective management of these things. The other thing that is really serious in terms of affecting the fight against the pandemic is the global water crisis. This is the water that is available, that is clean and that is accessible, is diminishing by the day. So there is a serious global water crisis. And to fight the pandemic, we need water to be availed. So in Kenya, the Directorate of Occupational Safety and Health Services, the Ministry of Labor and Social Protection, has issued some very pertinent advisories. We had advisories on employees with disabilities, and we have just developed a new advisory, which is advisory for frontline workers. And frontline workers do not include, do not leave out other sectors like truck drivers. Truck drivers are in the front line in terms of trying to transport and support the frontline leaders like doctors and nurses and other healthcare workers in the fight against this pandemic, especially at the tail end of the process, and that is at the hospital facilities and in public health facilities. So those supporting security guards and so on and so forth, those are also frontline workers. And we realized that they were also at an elevated risk with regard to this COVID-19. So we have proposed a few measures to ensure that workplaces are able to respond effectively to this COVID-19. And we have made these proposals today in about 4 areas. And the first area is on terms of policy. The second area is on risk assessments. The third area is on prevention and mitigation measures against COVID-19. And the last area is on arrangements for suspected and confirmed COVID-19 cases. Now, in terms of policy, we have said that there must or there need to be policies at the workplace that are very clear on COVID-19. And specifically, there must be teams at the workplace. There must be response plans on what happens in case of suspected or confirmed cases. And there must be systems for informing workers, systems for training, and other kinds of systems that support COVID-19, including the purchase of suitable, appropriate, and reliable personal protective equipment. Under this planning and policy, we have also proposed integrating occupational safety and health into business systems so that occupational safety and health is not regarded as an added issue, but part and parcel of how the business should be running. The second area we have proposed is on risk management and communication. And specifically, we are talking about how the companies and workplaces should be able to identify risk, communicate them to employees, and train employees on how they can protect themselves from getting COVID-19. One area and one of the most effective things that we have said is on prevention and mitigation measures. Specifically, there are two things that have been identified as the most effective in the fight against COVID-19. And the number one is social distance, keeping a social distance. And the number two is isolation. So in this slide, the main reason why people should keep a distance of 6 feet within the workplaces is that these are enclosed environments. They are specialized environments that require additional measures. You remember, outside of workplaces, there is a recommendation of 1 meter. But for these workplaces, we have said 2 meters is effective against because of the nature of the work environments. Of course, we have also said that people need to avoid touching surfaces that could have been contaminated, or hands, or joining crowds anywhere. And more so, people should wash their hands for at least 20 seconds with soap in running water, or use hand sanitizers. Now, there are different ways by which social distancing can be effected. And as I said, one of the challenges to the fight against COVID-19 is culture. And our culture is that we have to shake our hands and we have to hug each other. And all these things means that COVID is training us to do a different way of working. And this means that things like handshakes, keeping distance of 2 meters, avoiding crowds. And I think it is important for employers to note that when an employee gets injured or contracts COVID-19, it will have a very ripple effect on the workplace. So there is need for employers to come up with strategies on how they can convince employees to ensure that they avoid crowds. And one of the things that employers need to do, as we have just discussed, is to do risk assessment. And the risk assessment is going to advise on 2 main issues. Number one, it's going to advise on the different categories of workers that can be invited to work from home or can be requested to work from home. And it can also help employers to determine which of their operations are critical and must proceed within the existing workplaces. The fourth item is that workplaces need to come up with, measures or arrangements on how cases or suspected cases of COVID-19 in the workplace can be dealt with. And specifically here, we are talking about standard operating procedures, which should be developed in conjunction with workers so that they know exactly which steps to follow in the event that somebody is suspected or has a COVID-19. Either we also know that employees could also be having relatives or staying with relatives or persons who could be suspected or are cases of COVID-19. So we call those close contact cases. So we need to know, the employers need to know who among their staff are taking care of COVID-19 cases or have gotten into contact with a suspected case in the recent past. So we have several novel preventive measures, and these have been elaborated so well in the media. I have also talked about the need to have 6 feet within the workplaces. And here in this slide, we see exactly where people are safe. And the only place where you are safe is at home, I think. If you are at home and if you are alone, that is the only time that we can say you are safe. Anytime you move into a grocery or a supermarket, the color of COVID-19 turns yellow. And when you move into a crowd, it turns red. So it means that the best place, if we tell, for example, if we ask workers to operate from home, then we should also give additional instructions or support in terms of ensuring that they are not, if they are supposed to be at home, then they need to be at home. I have seen so many employees who are supposed to be at home, but you find them loitering around the markets, loitering around crowded areas. So, and as was said by the president, I think yesterday, these are some of the things that we cannot force people to do, but we must give them information to ensure that as they leave the workplace or as they leave their place where they were alone, they are heading to a red zone. The red zone is definitely a high risk for COVID-19. These are measures which can be issued at work in terms of social distancing within the work environment itself. Now, this picture is, I found it yesterday. These are dogs which have been trained to line up for food. And one of the greatest disappointing things that I saw or that I've been seeing in the recent past, almost on a daily basis, is people struggling, people competing to wash their hands. People cannot line up in our country. People cannot be patient to take care of themselves. And these are some of the most difficult things to legislate by employers. And I always say, because I've studied animals in my undergraduate program, I studied animals and plants. And I've said, from animals and plants, human beings can learn a lot. If they can line up like this patiently, and at the time when they're hungry, we as human beings, we can do better. We can do better than this. So this means that coronavirus cannot be stopped by one person. This reminds me of military training. And in the military, one of the things is that you enter a military as an individual and you remain a team member. So teams win. If individuals fail, teams also fail. So in conclusion, we must work together to stop this pandemic. Employees have a role, employers have a role, and the government has its own role also. We must accept transparent correction. This is a new virus. It has never been here with us before. This is the first time we are learning how to deal with it from all quarters. So we must be able to accept correction if necessary. Those countries which have refused to be corrected are developing now as the new epicenters of this corona virus pandemic. So there are no individuals in this fight. We just have one team, and the team is just headed towards stopping the pandemic and eradicating it from all our workplaces. And we need to respond to this pandemic of monumental proportion in unity. That is the only way that we are going to fight and stop the pandemic. So I want to stop here, and thank you very much for listening.
Thank you very much, Dr. Moroka. We appreciate the presentation. At this point, we will start off with the questions and answers. We'd like to get into an interactive session. So we invite you members to send in your questions, and those who are ready can also raise their hands. We'll give you a chance to ask your questions live. But before we get to that session, we'd like to address quite a number of questions that we received before today. We'd like also to inform you that we request for an additional 10 minutes of your time so that we'll be able to conclude and address all the questions that you have received. So to start us off, I'd like to bring on board our head of legal and IR, to whom I'll pose the first question. Grace, there's a question that is coming around the general responsibilities of an employer at this time. From a safety and health perspective, what should an employer do to ensure that the employees are not exposed and to ensure that they manage the issues that are coming through during this period?
Thank you very much, Grace. I think for now, it's important, even from what we have heard from our doctor, that employers must comply with the government precautionary measures. And of course, we do have those provisions also under the Occupational Safety and Health Act, where the employer is to ensure a safe working environment for those who are requiring workers to come to work. You must ensure that the social distancing measures are being observed, or you are observing them. You also have to ensure that there is the personal protective equipment, and this includes the masks. This also includes washing of hands. Ensure that you are provided for water and soap so that employees can consistently and constantly wash their hands with the soap. Ensure that you're also sensitizing employees on how to do it, because many times you can provide these things, but if you're not able to show them how to use them effectively and correctly, then it might be an act in futility. So it's very important that employees are shown and demonstrated to how to put on the masks, how to wash their hands, how to ensure that they keep the social distancing. And of course, the employer has the supervisory role. You must ensure that employees who have to come to work comply with those measures, because it's in futility if you are not able to supervise and ensure that employees comply with those measures. So it's very important that any case of suspected infection or of infection is reported immediately. That is what I would say, Grace, with regard to the employer's responsibility, that they must ensure they comply with the directives and also supervise and ensure that those directives are being followed. Thank you.
Great, thanks. So I'll just ask you a follow-up question to that. And the next question is asking around the risks, dangers, if employees are provided with these guidelines, but then they fail to follow them to the letter. What should an employer do, and what options should employers take to ensure that employees are following the guidelines that have been provided in the best way possible?
Yes, as I've previously mentioned, that it is the role of the employer to supervise and to ensure compliance. So in the event there is no compliance, and we know how risky this disease is in terms of the spread and it's the risk of infection, then the employer must take disciplinary action against those employees who fail to comply with the directives of the government. Remember, our employment laws under Section 44(4) provide for disciplinary action, and in fact summary dismissal for an employee. And we're not saying summarily dismiss. All we are saying is that those who deliberately refuse to comply with a lawful instruction by the employer, then they fall under disciplinary action. The employer should take disciplinary action. And remember, disciplinary action is only legitimate if the employer, and it's only fair if the employer, of course, has also done his part, has educated the employees, has sensitized them on how to comply in terms of how to use the masks, how to use the sanitizers, if at all, how to social distance, so that then there is a ground to take disciplinary action. So in the event of failure, then disciplinary action. And this time, it has to be something that you have to be vigilant about, looking at the risk and the cost that it would cost if you have your entire staff infected because of lack of compliance. So it is very important that the employer takes immediate action. When you see non-compliance, do not wait and do not prolong these processes, but ensure that you take them rapidly so that you prevent the loss of lives through the risk of infection.
Thank you, Grace. I'd like to get back to Dr. Andrew. There's a question that is coming through around the issue of face masks. And members are asking whether a face mask is categorized as a PPE. And if so, whose responsibility is it to provide that particular item that is necessary at this time? Dr.
Thank you so much, Grace. I want to confirm that the provision of masks to employees is the requisite responsibility of the employer. And secondly, masks are personal protective equipment. Thank you.
Thank you. So the next question, we'd like to have it addressed again by Dr. Andrew. There's an interesting question that has come through from a member who is working with a biological, who is working with in a company that works with biological control agents. And they work with animals and other laboratory tests are done in that particular place. So they're saying at this point, it is not technically possible for them to do all the prevention they need to do in as far as biological exposure to biological control agents is concerned. So what would you advise such a member to do in such a case?
Thank you very much again, Grace. I want to go back to one of the slides that I showed here, and that said that this virus is highly infectious. It means that it can attack so many people in a very short time, and it also kills people in a reasonable period of time, within a month or so. One thing I want to say about biological hazards is that they are categorized. They are biological hazards of the category where we have COVID-19. This is category 4, biological hazards. This category 4 are highly hazardous. There is no cure, there is no vaccine. Category 3 could be having a cure or a vaccine. A category 2 have a cure and a vaccine. And category 1 do not have, they do not seriously affect humans. So they are normal flora or biological organisms that we face every day. Now, if you are working, if this person saying they are working with biological hazard of category 4, and they don't have, it's not technically possible to prevent exposure, then they have to close that facility. I would advise they close it immediately. If they're in category 3, where there is a vaccine and a virus, and a treatment, then at that level, they need to work out ways by which they can limit the number of people that can be exposed at any given period of time. If they are working with category 2, of course, this is category 2, they're not highly infectious, and they can be worked on the bench. So these ones require very little protective requirements to enforce safety. If it is category 0, I don't think there is any harm in continuing with category 1 organisms, because the risk is very low. So what am I saying? Let them determine the risk level, and the higher the risk, the less activity they should have with that biological hazard. Thank you.
Thank you, Dr. Muruka. So at this point, I'd like to bring in our executive director, and there's a question that is coming through from members. It's touching on matters occupational, and what the position of employers is at this point in as far as whether this is an occupational disease or not. So Mrs. Mogo, kindly, if you can address that question.
Thank you very much, Grace. The strict answer is no. So far, the COVID-19 has not been declared an occupational disease under the Act, and that's what we've been telling our members. So our general advice is based on the general duty that is imposed on the employer as the occupier to provide for safety, health, and welfare of the employees. Thank you.
So a follow-up question to that we'll forward then to Dr. Andrew is asking about WIBA and whether then WIBA covers COVID-19 patients or the employer gets a policy endorsed for COVID-19 to cover its employees during this time.
Thank you so much, Grace. You are asking whether WIBA patients are, COVID-19 patients are covered by WIBA. Now, the only patient that is covered by WIBA is an employee who develops the disease in the course of employment. So if the employees are on duty, or they are in the course of employment, Work Injury Benefits Act will definitely cover them. Oh, okay, sorry. I was saying that all patients are not covered by WIBA. The only patients that are covered by WIBA are employees who are actually on duty or in the course of employment at the time of contracting the virus. Of course, all of you know that it is a very difficult decision to come to, especially if this person was not at the workplace, especially if he was working from home. It's a very difficult decision. But that decision will rest on the doctor, just like all other decisions about occupational diseases rest on the doctor. So the doctor, there are two things that the doctor must confirm. Number one, that it is an occupational disease. Number two, that it is compensable. And number three, that it has a percentage of disability. The other thing that has to be confirmed is that the employer has to confirm that the employee was on duty at the time of contracting the disease. So those are two important aspects that must be confirmed before an occupational disease is decided. When it comes to your last question, whether it will, how it will be done, I think this is existing insurance regulations apply.
Thank you for that. So we'll take one or two more questions then from the ones that have been submitted. Then after that, we'll give you a chance to ask your questions live. So you may start raising your hands now. So at this point, we'd like to ask a question that I will direct to Grace. And the question is around the costs of medical care. So this particular member is asking, should the employers meet the medical costs associated with COVID-19 cases at the private hospitals? Grace, can you address that?
Thank you very much, Grace. And it's important for us just to have a little background that when we talk about liability in terms of employers meeting costs, then we also have to look at who has the responsibility of care. And even as you have heard from Doctor, it's very important for the individual citizen, the individual Kenyan employee to take personal hygiene, personal responsibility towards their own hygiene and towards their own health during this COVID-19 pandemic. So for example, if the employer cannot control who you visit, how you social distance, for example, during the hours you're not at work, and also in terms of wearing your masks at all times, especially when you're exposed to crowds, then it becomes very difficult to pin that responsibility of costs on the employer. So employers are only liable when it comes to their failure to meet with their obligations under the law in terms of providing protective gear, ensuring social distancing, and ensuring that the employees at the workplace during this pandemic period are absolutely necessary to be there. So that if you recklessly expose your employees to the risk of infection, then perhaps you will be found liable, and of course that cost will be implicated on you. But if it is a responsibility of an employee to take care of themselves, their personal hygiene, then that cannot be imputed on the employer, and the employer will not be held liable for that. Thank you, Grace.
Thank you, Grace, for the responses that you've provided. I've seen someone who is asking for a repetition on the question on the occupational disease. I think what you will do is provide a checklist on the key guides that you need to look at, so that then we can provide that to you later on. There's a question on the costs, Daktari. And people are saying, you know, if you're asking us to provide these masks to our employees, we have institutions like learning institutions that have thousands of employees. How will employers manage that particular costs? And maybe you can touch on that as you go to the next. Are there some government initiatives that are meant to assist employers to take care of such a cost?
Up to today, thank you for the question, Grace, again. Up to today, we have not seen any government budget to buy for any other person personal protective equipment. And as I said earlier, when it comes to employees, that is the burden of the employer. It cannot be shifted to any other person. The government has already, as you know, has already reduced some taxes, various taxes on, and the government is also in partnership with several companies to make available masks, for example, and other PPE. So all these are government initiatives to make these things available. But the ultimate responsibility, or the primary responsibility, to ensure that these masks are available at the workplace, or for employees, for that matter, is the work of the employer. So it cannot be transferred at this time. Thank you.
Thank you for that. So at this point, we will ask one question live. So we'll allow Cosmas to ask his question. Cosmas, are you there? Cosmas, are you there? Okay, we seem to have lost him. When you're ready, Cosmas, we will get back to you. In the meantime, we'll ask Grace Ndegwa to ask her question. Okay, Grace, kindly write your question. We seem to have challenges. I'd request all those that have their hands raised to write down their questions. Then we shall have them addressed from the panel. At this point, we will ask a question that is pointing towards issues of quarantine. And I will direct this question to Grace Kanyiri. And this question is asking, suppose a staff on quarantine, staff is on quarantine for 14 days, and then is put again on quarantine for another 14 days. What's your advice in terms of the leave that this employee is taking? Is this annual leave? Is this compassionate leave? What type of leave you advise the employee to take at this point?
Thank you very much, Grace. I believe Doctor can also help me in answering this question, because when we talk about quarantine, we are not talking about a necessarily sick employee. We are talking about somebody who has been sent to an isolation center or has been told to isolate themselves. This is directly by government directives that you have to isolate yourself, perhaps because you've been in contact with somebody who is infected, and so on and so forth. So in terms of the liability of the employer, and if we could remember that liability is always attached to a responsibility, then it is the responsibility of the individual to be isolated at a time as such, especially if they've been in contact with an infected person. And how can this be visited to the employer in terms of cost if the employer has indeed fulfilled his or her obligations under the law to ensure the safety of the So quarantine is not sick leave. And so in our current law, we do not have any provision that provides that cost to be visited upon the employee, or rather employer, sorry. So I think that is important to say that it is not a cost to be visited upon the employer unless the employer's responsibility is shown to have failed, or the employer takes it upon himself to actually isolate those employees at his cost, perhaps in his premises. Then that cost definitely would be visited upon the employer. But out of that, we do not have a law that would require the employer to bear that cost. Thank you, Grace.
Thank you, Grace, for that. So we have requested that you type down your questions. We can only take one or so live. So at this point, we'd like to allow Nancy. Are you there? Nancy, kindly unmute your mic.
Yes, I have. Good afternoon, and thank you very much for that very insightful presentation. I think I had raised my hand, and I think Grace has partly answered my question. And the question is, if an employee finds herself or himself infected with the virus on their way to work or from work, and they land themselves in a private hospital, and clearly the insurance does not cover for that, should it still be the employer to pay for the medical cost in a private hospital, or should they be channeled to the government hospital? I needed to get that very clear, and it was not quite well articulated by Grace.
Okay, Grace, kindly just clarify that. This employee was going to work. I don't know whether there was a measure of saying this person was infected or going to work or not. But the question is, the person was on their way to work and they were caught up and were put in a private facility.
Yes, as I said, responsibility, a liability is only touched where there's a responsibility. So if an employer has required an employee to come to work, perhaps during the curfew hours, I don't know, because at what point is he being caught and kept under quarantine? But if the employer has failed in their responsibility, then that liability can be attached to the employer. Remember, this is a unique circumstance, so we cannot give a prescriptive answer and say that employers are liable for quarantine. It's a specific case with a specific response. So in this case, that's what we mean, that if you had a responsibility attached to now that employee coming to work during curfew or caught up, and then now they are caught, then you had a responsibility, then there's a liability that can be attached. But in this case, quarantine that has been given as a directive by the government, then I believe even the government, as we speak, is already taking care of that cost in terms of isolation centers and so on and so forth. So I believe I am probably now clear. Thank you, Grace.
Thanks, Grace. So at this point, we will ask Cosmas to ask his question.
Yes, I'm getting you clear, Grace. Thank you very much. Are you getting me?
Yes, we are.
Yes, my question is on the quarantine costs. Some of our employees are working in these quarantine and isolation places, and the government has taken the affected people or infected people there, and they end up infecting the employees who are there. And then the cost is pushed to the employer or the employee when they were working in that. Who is supposed to take that cost? Is it not the government?
Okay, thank you very much, Cosmas. We have heard you. Dr. would you like to take that question, please?
Yes. Yes, I think the issue of, let's start with the first one that was talking about somebody who contracts COVID-19 on their way to work. What I want to stress is that between 5 to 80% of those who contract COVID-19 do not have any symptoms. They do not have any symptoms. And you cannot contract COVID-19 on the way today and then you get to hospital the same day. It is not easy unless you are meeting a testing team. And that should be noted so that it is not possible to contract it on the way the same day and get it the same day and then be quarantined the same day. It's not possible. The greatest problem that we have with COVID-19, as I've said, is that those who do not display any symptoms are much more, and they are in the streets. And that is why you find that recently the government decided that we need mass testing. Now, the other problem with mass testing is that the testing kits are globally in shortage. So these are difficulties that we need to understand. And when it comes to quarantine costs, and somebody is saying that, Cosmas is saying that some of their employees are working there and then they get exposed. And then when employees get exposed to COVID-19 and they are your employees, they become your responsibility. You cannot transfer it to any other party unless you transfer that by way of contributory negligence. In that case, you might say that the person who is running the quarantine center did not provide sufficient safety measures. But you see, that is now in court. For that, you have a patient to do. Thank you so much.
Thank you. So, Dr. I'll ask you one more question that has come through, and this question is about the need to put on surgical hand gloves at work. Is that necessary?
Thank you very much. The issue of surgical hand gloves at work has been investigated. If you ask me, I would say these are only useful in a healthcare facility. If you are outside of a healthcare facility and you are in other types of workplaces, then continuous cleaning or the disinfecting of the workplaces is more profitable than wearing these gloves and so on and so forth. But in a hospital facility where you don't want to transfer one COVID patient virus to another COVID patient virus, or to other people who are not necessarily infected, then you don't need gloves.
Thank you for that question. So one more that is coming.
Get answered my question.
Sorry, there is another one. Sorry.
Get answered my question.
Yes. Can I continue?
Yes, you may answer the one you have.
Yeah, I've been asked, can the masks be washed? This means that this person is asking, can the masks be reused? From my knowledge, the first country to ask masks called N95 to be reused by doctors is India. And what we must understand is that N95 mask is in short supply worldwide. And that is probably one of the few reasons why some countries have accepted that this N95 must be washed and be reused. And there is a whole protocol on how this is supposed to be done. Now, when it comes to the local masks that are made by our tailors in this country or anywhere along the streets or in the estates, these masks are reusable, so they can be washed, they can be disinfected, and they can be reused. And that has been, I think, the government stand. This can be reused but there are certain other masks that are disposable. I mean, those ones are single-use masks, and those ones are clearly written as they come from the supplier. They clearly indicate that this is purely single-use. So that is why it is important as we buy masks at the moment to ensure that every mask that you buy, if possible, is accompanied by a product manual or some kind of a QR code that you can now refer and confirm that is single use or can be used more than once. Thank you.
Thank you, Dr. Ari, for that. So we are getting to the tail end of our discussion today. So kindly put down your questions, write them to us. We'll make sure they are addressed. But before I let Dr. Ari go, there's a very important question here that is coming through around issues of testing for COVID at the workplace. Is the employer compelled to do the testing, to do some basic testing at the workplace, and what would that entail? If you can probably give a quick guideline of some things that employers can do at the workplace so that we close that discussion.
The only thing that one of the things that I've seen being done by employers is to test for temperature. And the temperature is a good indicator of elevated, temperature within the body. And it is one of the approved symptoms for COVID-19. It is just one of them. Employers at the moment, unless it is a medical laboratory approved by government, it's not possible to conduct the whole test for COVID-19. So that is still under government, and I think the Ministry of Health is the one that now approves all the testing companies or institutions. So I think at the moment, for you to be tested and confirmed to be having COVID-19, it is only the Ministry of Health that is having that mandate. Thank you.
Thank you very much for that. So we will close that session. We are getting to our closing remarks. We have received quite a number of questions from you. Some are even asking about what to do to promote a culture of safety as we move forward. If the government has further improvement frameworks that can be provided, and we'll be able to address some of these questions by responding to you. So all questions received will get a response. At this point, I'd like to hand over to our Executive Director, Mrs. Mogo, to take it from there. Thank you.
Thank you very much, Grace, and members for your active participation and incisive questions. Having listened to what is coming from the members, I think my main takeaway is that the responsibilities that the employers have or had before COVID-19 descended on us are still there in terms of occupational health and safety. And our key responsibility as employers is really to provide safe, healthy workplaces that also take into account the employees' welfare. If we focus on this and take on the duty of care for our employees, then a lot of the questions you're asking will be taken care of. It may not be stated in law, and it is true that COVID-19 is not an occupational disease. Yes, the government is the one testing and actually taking care of treatment of employees, but one or two people end up in private hospitals, and you have insurance cover and medical arrangements in place. Your employees are insured for illness. So a lot of this will be your decision as an employer as to the extent of involvement that you have. If an employee is sick and for some reason they end up in a private hospital, you may want to consider taking responsibility, or if necessary, facilitating the transfer of such an employee to a public hospital if possible, so that in matters of employment, it's not always a hard and fast rule that because the law doesn't say it, the law sets the minimum. It doesn't stop us as employers from going beyond that minimum, but a lot of it will be dependent on your capacity. So if we take into account the measures that Grace Kanyuri and Dr. Muruka are talking about in ensuring that we play a role in enhancing employee safety, in making our workplaces safe, and also making the employees aware of their personal responsibility for their safety and health, even when they're at home, then a lot of these things will be addressed. I think we also take away the fact that we are responsible as employers to report to the health authorities, and this we are required to do where you suspect that any of your employees is infected or affected. That is the duty of the employer to report and to ensure that your employee gets the attention, the medical attention that they need. And also, if you suspect that more than one or that the workplace has become dangerous, then you may very well consider shutting down completely for a while to ensure the safety and health of your staff. In fact, many employers are currently not working up to full scale. So a lot of it still depends on us employers making informed decisions. We want you to stay engaged and let us know your experiences and any issues you may have going forward. We are also in the process of carrying out a survey in conjunction with the International Labour Organization. We just have a few more days before we close this survey. We had sent it to you via email, so please log in and give us your responses so that we can have as much information as possible from Kenya, because this is an Africa-wide survey that will inform interventions going forward. On and off, we'll also be asking you for inputs. Should we see a bill or a law or some proposed policy document that comes, we'll be sending you requests for inputs as we did last week on the pandemic response and management bill. And we'd like you to respond and give us your inputs so that we use information from you in preparing our positions. We appreciate the employers who continue to support government efforts in the interventions against COVID-19. We know that quite a number of you have made donations, either in kind to help the communities around you. Some have contributed to the Emergency Response Fund. A few members have asked us if they can actually contribute through the Federation, and we are open for that. We will, of course, channel it to the national response, and we encourage you to continue doing this at this time of need as employers. We've talked at length about the guidelines that we issued and the employer's responsibility. We'd like to encourage you to continue implementing those guidelines in compliance with what is expected and to support the ongoing national efforts to contain the spread of COVID-19. And please, we are still open as FKE. We have a skeleton staff. Most of us are at home, but there are a few of us available to help you. We have a hotline, so if you're in need, do get in touch with us and we'll ensure that we respond accordingly. Once again, I want to thank Dr. Muruka very sincerely for taking his time to share with you members from a government perspective what is unfolding in matters COVID-19, our role as employers in helping combat that. And tomorrow, as we celebrate the World Health and Safety Day, please review the measures you put in place, take them a higher notch to ensure that our workplaces are absolutely able to provide employees with everything they need. Should it be masks? Should it be facilities to wash their hands? Should it be support that they need in terms of knowledge, that we play this role to enhance health and safety in this country? So do stay safe, and we look forward to seeing you next week. Again, thank you very much for your participation. From us here at the Federation of Kenya Employers, it's goodbye for now.